Okay, continuing on with the abdomen, I want to talk about these pathologies that are common to all arteries, not just the arteries of the abdomen, but I want to talk about these pathologies. And then here I have listed the interventional procedures dealing with the vascular anatomy of the abdomen. Okay, right off the bat, I have coarctation of the thoracic aorta. And again, this is an anatomy, or this is a pathology of the thoracic aorta. I just failed to mention it when we were talking about the thoracic aorta. So I just want to kind of mention it now. But coarctation is a congenital narrowing, meaning it's not acquired. This isn't something that the patient can help. I mean, they were just born with it. And this is coarctation of the aorta, a congenital narrowing of the thoracic aorta. Here I talk about atherosclerosis. And atherosclerosis, quite honestly, is why all of us have jobs. It's an accumulation of plaque. It causes the arterial walls to weaken and become diseased and causes all kinds of problems. And I have a video lecture just on atherosclerosis. Here's what a AAA looks like, an abdominal aortic aneurysm. So here we have what looks like a normal aorta. Here we've got the celiac artery, the superior mesenteric artery, the right and left renal arteries, the inferior mesenteric arteries. And look here, this picture even has the gonadals, the right and left gonadals coming off. And then here we have what an aneurysm looks like. An aneurysm is an abnormal bulging of an artery. And that could be, again, of any artery, but this is just demonstrating of the abdominal aorta. And then here you can see it bifurcates into the right and left common iliacs. Dissection, that is a separation of the intima layer, which is the inner layer, from the media, which is the middle layer. So basically a tear is created in the intima, and that causes, or that allows rather, blood to flow in between the layers, in between the intima and the into the media. And so that causes a true and false lumen. So this would be considered the true lumen, where the blood is supposed to be going, but then blood also flows through this false lumen. And again, this is showing the thoracic aorta, but these tears a lot of times do start in the thoracic aorta and then they tear all the way down to the abdominal aorta. And so that's what an aortic dissection is a separation of the layers of the artery.